569 people lying on trolleys, and indeed most of them sitting on plastic chairs with drips hanging out of their arms, so ill that they need a hospital bed and we can't give it to them, but yet leave them there with no privacy and in distress. I don't have to tell you how bad our health service has become. And with 20,000 operations cancelled last year, and behind each of those figures a real person, a real family, making arrangements, taking time off work to have children minded and businesses looked after, only to have it cancelled at the last moment, you know how dysfunctional the whole situation has become. We in Fine Gael have a policy that will fix that. It's called Fair Care. It's based on using what we have by using the National Treatment Purchase Fund to end our waiting lists, using the mechanism that was used in the north of Ireland, where they got rid of a 57,000 person waiting list through a special delivery unit at a cost of £36 million over a period of 18 months. Now, we spent €100 million in the National Treatment Purchase Fund every year for the last 3 years, and we're making no progress. We need to build the primary care centres that we've been talking about, that will have the doctors, nurses in them, that will have rooms for visiting consultants. Why should 35 people leave Balbriggan, Swords or Malahide to go to Beaumont when one doctor could travel the other direction, or indeed come from the Mater or Drogheda? And we want to ensure that we bring in a money follows the patient system in our hospitals, so that we end up with a scenario where the patient is central. Because simply put, if we pay per patient seen, per procedure performed, per surgery carried out, then the patient is central and there will be no payment if there is no patient. We also want to build in our communities more convalescence with physiotherapy, occupational therapy, speech and language therapy, so that people can finish their acute phase of treatment in hospital and leave then back to their communities, near their families, to continue their recovery. That doesn't exist at the moment. Ultimately, we want to bring in universal health insurance where every man, woman and child will be treated the same, will be insured. There will no longer be a two-tier system. And where GP services will be free at the point of delivery. One specific thing that we will do once we're in power is extend the cervical cancer vaccine to catch up all those children in secondary school. And we will start that in September of this year. It is extraordinary that we have a vaccine that can prevent cancer, and yet we deprive our young children of it. We want to bring in universal health insurance and fair care because it delivers fairness and equity across the health service in a safe and timely fashion. Holland has this system. We want it, and Fine Gael will deliver it.